The World Health Organization last week decided that the COVID-19 pandemic remains a public health emergency of international concern, given its continued threat against the vulnerable. So how are pundits responding to this decision by the global health body? What are the prospects of Korea lifting its isolation mandate for COVID-19 patients? And what look to be the broader implications of lifting COVID-19 emergency declarations in the US? Welcome to Issues and Insiders. In today's edition, we touch upon the pandemic and its related measures here and elsewhere. For more, I have Professor Howard Lee at Seoul National University live on the line. Professor Lee, it's good to have you on.
Thank you. Good afternoon.
I also have Professor Peter Chin-Hong at the University of California, San Francisco, joining us virtually as well. Professor Chin-Hong, it's great to see you again.
My pleasure, Sunny. Thanks for having me on.
Right. Professor Lee, we'll start with you then. Perhaps we can start off with a few thoughts, or your thoughts that is, regarding the global health body's decision to maintain its global health emergency status for COVID-19.
Okay, as you mentioned, a week ago, the World Health Organization said COVID-19 still remains a global health emergency as we enter the fourth year of the pandemic. At the same time, however, WHO Director General said he was quite hopeful that the world still will transition out of the emergency phase of the pandemic this year. So in essence, WHO said the pandemic isn't over, but an end is in sight. I think the WHO's message was mixed. First, they warned many countries and societies where the level of alertness and anti-COVID-19 measures have been deprioritized recently, partly due to pandemic fatigue, insensitivity, or even ignorance. But WHO also seemed to encourage people that we had to be ready for getting back to the pre-pandemic routine, although nobody knows at this point when it will actually start and how long it will take.
Right. And Professor Chin-Hong, what are your thoughts on this cautious stance by the World Health Organization, which, as Professor Lee mentioned, the entity did say that the world is in a better place than it was a year ago?
Well, overall, I agree with Professor Lee. I think there are probably three reasons why the WHO took this more cautious stance. The first is the burden of disease. There's still millions of cases around the world and thousands of deaths daily. The second is the global inequities that still remain. And the third, probably the most important point, is that we still need politically to maintain this front and center so that governments don't have an excuse not to focus on it in countries where they may not have had as many resources. After all, the WHO is going to reevaluate this in 3 months. And probably at that point, it may no longer designate that as a public health emergency of international concern.
Right. Professor Lee, Korea, for the time being, though, it's chosen to further ease its COVID-19 related restrictions by largely lifting its indoor mask mandate. Now, the public response here, Professor, I'm sure you'll agree, is rather mixed. What are your thoughts?
Well, many people, including myself, certainly have welcomed the lift. But I have to also admit that easing restrictions could be concerns to some others. Well, that is reality. There is no policy or system that meets everyone's expectation. That said, it is quite interesting to note that many people inside a building or even on the street are still wearing a face mask. Sometimes I feel kind of guilty since I'm the only one not wearing a mask. Of course, nobody has argued with me for that matter.
Right. Professor Chin-Hong, the Biden administration, for its part, has announced intentions to maintain the U.S.'s COVID-19 emergency declarations until the 11th of May. How do you respond, and what are the broader implications of this ultimate lifting of these declarations?
I think the most important thing for me, Sunny, is that it doesn't mean that COVID has gone away. Not declaring it a national emergency doesn't mean that it's not around. In fact, it's still killing about 500 Americans every day, which is much more than the worst flu season. I think the broadest implication will be financial. Millions of Americans will lose health coverage. We don't have a national health system like many parts of the world. And what that means is that there will be a patchwork of services depending on your insurance status as to whether or not testing, vaccines, and therapeutics would be paid. So that would lead to confusion. And, hopefully there'll be safety nets, but that will be variable across the country.
Right. Professor Lee, there is talk about a complete lifting of Korea's mask mandate in May and eventually a lifting of Korea's isolation requirement for COVID-19 patients as well. Do these measures, Professor Lee, look to affect our COVID-19 related tallies, do you think?
No, I don't think full lifting of Korea's mask mandate, possibly followed by stopping mandatory isolation, will badly affect the COVID-19 statistics in any degree whatsoever, at least for the time being and in the near future as well. While those restrictions were in full effect in the past, we still could not evade the resurgence of COVID-19 waves. It was primarily because the new variants or subvariants were too transmissible to be curbed only by those restrictions and anti-COVID-19 measures. As we are getting out of the most recent uptake, with all the COVID-19 tallies being stabilized, it is quite unlikely that easing all the previous measures could haphazardly and negatively impact the situation.
Right, and hopefully you're right then. Meanwhile, Professor Chin Hong, what can you tell us about the overall COVID-19 situation there in the U.S.?
Well, in the U.S., Sunny, things are looking better. We are down about 20%, at least from the official tally, in terms of cases, hospitalizations, even trending downward in deaths. Although, like I mentioned, it's still pretty remarkable that almost 500 Americans are dying every day, which is heartbreaking because we have the tools to make that close to zero. At the end of the day, I think even though cases are down, there's still COVID around. People are still doing poorly. But in the American consciousness, people are very much checked out psychologically.
Right. Professor Lee, back here in Korea, despite the recent ease in indoor mask requirements, quite a number of people continue, like you mentioned, to wear their face masks. I wonder, is this reality out of habit, do you think, or concern?
Well, that is something that I'm not 100% qualified to answer. The question is more or less about culture and custom, not just science. Anyway, I don't wear face mask as long as I'm legally allowed not to. I use public transportation every day in Korea all the time, and I don't wear a face mask when I check in the ticket until I actually get in on the train, for example. However, many people are still wearing face masks outdoors and indoors altogether because they see it more convenient. In other words, no need to switch back and forth. In addition, some are still wearing face masks because it gives them a sense of safety. One way or another, we used to and still do wear face masks in the winter and early spring season out of concern in the past about the poor quality of the air. So I think Koreans are naturally mask-wearing people, and many get used to that for many, many years.
Right. Professor Chin Hong, Professor Lee just mentioned public transport. Now, Germany and Spain have lifted their mask mandates for public transport this month. Korea, in the meantime, still requires face masks on public transport. That all being said, what can you tell us about mask requirements in the U.S., including at healthcare facilities and perhaps on public transport?
Well, I would say, Sunny, that in public transportation, mask mandates generally across the country have been dropping since around September of 2022, but it didn't mean that people weren't wearing face masks on public transit. In fact, what we emphasize from a public health perspective is that if you're older and maybe not optimally vaccinated or immune compromised or lived with one of these groups, you'd still probably want to wear a mask, but wear a good quality mask. In healthcare facilities, they never went away. I still wear a mask every day when I go to work in the hospital, and that probably won't be lifted anytime soon. Maybe after May 11th with the national public health emergency ending, but it will be guided by epidemiology. It does give us, as healthcare workers, psychologically, a better sense of safety at work, and I think that it makes everyone have a higher morale.
This is an impromptu question. Professor Ching, I feel like you believe that the mask should remain within healthcare facilities perhaps longer than May 11th. What do you say?
Yes, I think that it probably will be the last place that I would want it dropped. I think early on, just in the last day or so, we got a report of tens of thousands of physicians who died during COVID. And I think that really spoke to the sense of powerlessness that we all felt early in the pandemic. And when we got those mask mandates, people in healthcare facilities felt better. I think they will eventually go away, but probably the last thing or the last place would be the healthcare facilities.
Right. Moving forward, Professor Lee, given the latest developments, do you suppose efforts to develop vaccines and treatments for COVID-19 still matter?
Yes, I do. We have to develop new treatments and vaccines, not just for COVID-19, but for many unseen future infectious diseases. The greatest lesson, I think, we could learn not only from the COVID-19 pandemic, but also from the previous epidemics such as MERS, flu, and SARS. Human existence will be threatened on a continual basis by newly emergent or sometimes existing but varied infections on a regular basis. So to prepare for those public emergencies, we have to keep in developing treatments and vaccines, no doubt about that. But development is one thing, and also developers like biopharmaceutical companies need to have some kind of backup, in other words, safety net, in a way that the government can buy or procure some of the stocks that they will eventually produce. Without that kind of guard or guidance, if you will, nobody wants to invest a lot of money in developing treatments and vaccines against infectious diseases.
Right. And Professor Chin Hong, what are your thoughts on continued efforts to combat COVID-19 despite its relatively reduced prevalence, if I may?
Yeah, so there are three reasons I thought about, Sunny. The first is that, like I mentioned, 500 deaths a day is not small change, and that's worse than any flu season that we've had before. In fact, if you think about where it will settle down to, 100,000 deaths a year in the United States is something we didn't have in 2019. The second reason is that there continue to be inequities in the American population. We don't have a national health care system, so vulnerable populations have a disproportionate impact from the disease. And the third is really the ongoing effects of long COVID. It's estimated that probably 3 million Americans have been out of the workforce, and that, from one analysis by McKinsey, is about $168 billion in lost revenue. So I think all of this really makes us want to remain laser focused on COVID, even though it's gone from our psychological consciousness.
Right. And Professor Chino, a recent report there in the US showed that COVID-19 is among the leading causes of death for children in the US. Is this a concerning reality, do you think?
Yes, it is a big concern, but many parents are looking around and seeing that many kids are also doing well, so they don't really see these numbers or the people in the hospitals that we see. In fact, it is the #1 cause of infectious deaths in children aged 0 to 19, most in the youngest age groups. And, I think what we continue to need to do is to focus on vaccinations and also on ventilations, particularly in schools.
Right. And Professor Lee, has Korea's experience overall with COVID-19 thus far made it better prepared for future pandemics?
Absolutely. Any penny spent in making Korea up to par with the pandemic and experience we as a nation have gathered down the road will certainly help Korea get ready and be better prepared for future public emergencies, including newly emergent pandemics. This is exactly what happened in the battles against the previous epidemics in Korea. Through the challenges and responses, as put by the great historian Toynbee, Korea has successfully developed and updated quarantine manuals, systems, and efficiently put them into practice. This will do a job when new pandemics comes back.
And Professor Chen Hong, what are your thoughts with regard to the preparedness by the US with regard to future pandemics, given their experience with COVID-19?
Well, Sunny, I think given our experience in the early part of the pandemic when coordination wasn't the greatest, I think we all remain nervous, but the Biden administration did get some funding to formally establish a White House Office of Pandemic Preparedness in December of last year. We hope that it will achieve at least several items. First, technology that continues to be developed. Secondly, global cooperation, but that's always a political divisive aspect in the United States. And third, political will. At the end of the day, it requires a lot of money, which again, in a divided Congress is easier to say and harder to get.
Yes, it is. Professor Lee, beyond the pandemic, there is said to be a universal shortage of healthcare workers. That being said, what do you propose with regard to addressing this challenge here in South Korea?
Yes, according to a study published last year by the Institute of Health Metrics and Evaluation at the University of Washington School of Medicine, more than 43 million additional health workers are needed to meet targets for universal health coverage around the world. The front line has been further swept by the COVID-19 pandemic, as we have seen very closely. Therefore, we have to tackle on this issue by highlighting and addressing factors that may contribute to health workers' shortages around the globe. They include out-migration of health workers, war and political unrest, violence against healthcare workers, and insufficient incentives for training and retention of healthcare workers. The two latter of which have still ailing Korea in many forms. So we have to realize those issues on an urgent basis, and we have to tackle on that issue as soon as possible.
Right, hopefully as soon as possible. Professor Ching-Hong, what are your words of advice with regard to response measures to ease staff shortages in the US medical arena?
Well, I think this staff shortage has been going on even before the pandemic, but was amplified greatly with the loss of morale, burnout that happened during the pandemic. So there are several things that could be done, and many people believe a combination of them. The first is investing in public health. If you invest in public health, the population health gets improved, so you require fewer services in the hospital. The second is invest more in allied healthcare workers, nurse practitioners, nurses, nursing assistants that can deliver a lot of care, and we need to empower them. The third is, to have a more diverse workforce and to also employ some of the techniques we use in COVID, like telemedicine. People don't have to come into the hospital physically anymore, and you can really ramp up seeing a lot more people in that way. At the end of the day, I think it's a huge problem that we really need to address really acutely.
Right. Professor Lee, Professor Chin-Hong just mentioned telemedicine, which remains a debate here in the country, I believe. Could you tell us a bit about your thoughts with regard to telemedicine?
Well, it's the future. But there are so many people and societies and also kind of old-style guilds that are involved in the advancement or against the advancement of telemedicine in South Korea has been ailing, has been deterring. That kind of concept to be processed further. But I have to say that that is something that prevents us from moving forward, because telemedicine or kind of offline, online medicine is something that we'll encounter on a daily basis in the future. So we have to graciously accept. And also, there are many patients out there who are very welcoming the introduction of telemedicine because it will make their lives a lot easier and more convenient.
Professor Chin-Hong, earlier on in our discussion, you mentioned about the importance of having some form of strategy, security, a safety network, that is, to better prepare for the US's lifting of emergency declarations with regard to COVID-19. Professor Chin-Hong, would you like to take this opportunity to perhaps share some of your thoughts with regard to possible safety measures?
Well, I think that unfortunately, because we don't have a national healthcare system, we don't even have a national health information system. I'm really, really worried about people who are going to fall between the cracks. It does require investment by local jurisdictions. Public health in the United States is very local. The CDC only makes recommendations, but it's up to local jurisdictions to effect their own changes. So I think it's going to be a tough situation, particularly since today we learned that Pfizer and Moderna have established the new prices for vaccines on the market, and that's going to be anywhere from $110 US to $130 US per shot. So that means that local authorities will have to pay more than what the government paid originally. So all of these things make me a little bit nervous, but there are stopgap measures for certain populations. But I think we can only encourage, we can only fund, and then be flexible when things look bad and turn south.
Right. Professor Lee, we talked earlier about how the government here is planning to lift the mandatory isolation for COVID-19 patients, which in itself has raised quite a bit of debate. Do you suppose now would be the right timing? By now, I of course mean when the weather gets warmer, which is what many are predicting will happen. But when the weather gets warmer, would that be the right time to lift the COVID-19 mandatory isolation for patients, or should we wait a bit longer?
Well, I think, as the weather, is getting better and warmer and warmer, more people will go outside and mingle together with each other. So it is more likely for any infection to be transmitted from one person to another. But at the same time, people, have been trained for 3 years, and this is not. This is something that we have to deal with very seriously. And many people, I believe that whenever they are diagnosed with COVID-19, then they are kind of protecting themselves, also protecting others by making some sort of self-directed quarantine in effect. So. In other words, this is something that we have to let people do by themselves, not just something that the government says, okay, do something that you have to do, or otherwise you will be fined or go to jail. That kind of thing, I don't support anymore. So we have to believe, and we have to trust the people's they are educated guests, and they are educated and trained action based on the lessons that they got learned from the 3-year experience with COVID-19. So we have to trust them.
Right. I suppose we can trust members of the public to take responsibility and to take responsible actions, of course. Professor Lee, as always, thank you very much for your time and your thoughts. And Professor Chin Hong, thank you so much for taking my questions as well as my impromptu ones.
Thank you so much. Bye-bye.
Right, well, that is all the time we have for this edition of Issues and Insiders. Thank you for watching. See you on Friday.